Kiran from MD Health Tech, and I'm sitting here with Stephen Williams and Rohan. And in today's webinar, we are discussing about the referral coordination and how our HIPAA certified, well trained virtual assistant can make your patient's journey from PCP to specialist go smooth and steady. So, my first question will be with you, Stephen, that what causes most referral to fall through the cracks in a typical practice setting?
Thank you very much. So first of all, thank you very much for having me today over here. All right, so Kiran, your first question. So the answer to the first question is that most of the specialist or offices what they do or the primary care physicians offices what they do, they have just one person working onto the front desk or like they have a person working back onto the referral coordination. What happens, let's suppose like if a person from the front desk takes off on a day, the backend person starts covering the front desk and the referral coordinator. That actually that position gets empty. Now, if the patient needs an urgent referral or needs an appointment with any kind of specialist, they won't be getting the referral in a timely manner, and the referral will be falling through. If the referral will be falling through, patient won't get the treatment on time from the specialist, and obviously the PCP might lose the patient because of
Mhm.
irregular workflow.
100%. Great way to add that. Now, we do have some other questions for you. Now, obviously, there's a lot of documentations in referrals. How do incomplete clinical records directly impact patient outcomes and specialist engagement?
So usually what happens over here, let's say if the patient comes to the PCP checks the patient and PCP refers the patient to the cardiologist or any kind of other specialist, depending upon the severity of the condition or the specialty that they need to refer the patient to. So they're referring the patient out towards the cardiologist. Now the referral needs to be sent. Now it's not only just referral that needs to be sent to the specialist. With referral, there are some documentation that also needs to be sent to the specialist, which includes the all the clinical notes, the progress notes, and even though some labs as well that have been recently done for the patient. If they are not sent and like there's a documentation gap, so obviously specialists won't be getting the complete information out for the patient for that particular condition for which the patient is being referred to the specialist, and the patient will be ordering those tests again from for the patient. So that might actually cause the patient, you could say, a disturbance, like why I'm going for the same test again if I've already done from the PCP office.
Got you. Good information. Thank you, Stephen. And my next question to you is what does an ideal referral process actually look like when implemented in a live practice?
So what happens over here actually is that patient comes into the office, patient gets him or herself checked by the PCP. PCP checks the condition for the patient, and upon the disease type, patient is referred to the particular specialist. Let's suppose a patient is referred to a cardiologist, for example.
Mhm.
Now, the referral coordinator into the patients into the PCP office, they will go onto the insurance portal. They will authorize the referral, the initial code, the first time consultation code, as well as the follow up code. According according with that, they will attach the clinical notes. They will attach all the labs, and they will send the authorized referral from the insurance towards the specialist office. Specialist office will check the referral, they will call the patient, they will get the patient onto the schedule. So this is a complete workflow from the PCP office towards the specialist office for the referral workflow.
Now, obviously, referrals is a very important thing, but also another big important thing is revenue. What ROI have practices seen from improving referral coordination processes?
So as you can see over here on your screen as well, like 25% is the revenue recovery. Like let's suppose average increase in captured downstreams revenue when like referral leakage is reduced through the structured coordination. If the patient is getting proper timely referral towards the specialist, patient is getting proper appointment towards the specialist, referrals are not being declined by the insurance, patients are not being seen without referral, obviously then the doctor's offices are not getting any claim denials. They will be submitting the claim towards the insurance. Insurance will first of all check whether the referral was in place for that particular time and the patient got him or herself checked by the doctor. If the referral was in place and everything was on track, so the denial is eliminated. And obviously if the denial is eliminated, so the revenue is steadily or it is increasing.
And, can you tell us how do you ensure closed loop referrals compliance? What processes are in place to document specialist feedback back into the patient's chart?
So the closed loop referral is something like the PCP office initiates the referral, get all the documentation in process, get the authorized referral from the insurance, sends the referral towards the specialist office. Patient is being called by the specialist office, gets an appointment, referral is there, specialist checks the patient, everything that a specialist does for the patient, like their progress notes and everything, they are being sent back towards the PCP office and their medical record is updated into the PCP office. That's a complete closed loop referral from a PCP to a specialist and from specialist back to PCP.
And obviously, client compliance is very important. But now let's talk a little bit about outsourcing. What measurable improvements in accuracy, speed, and cost have outsourced teams demonstrated?
So as you already as I already mentioned over in the first side as well, like let's suppose if the referral coordinator is performing a referral on one day, second day the doctor gets a call from the front desk staff or any of the other staff. I'm not coming in today due to XYZ reasons. He will or she will ask the referral coordinator to cover that particular position. In that way, the referral is being compromised. If the referral is being compromised, they are not properly sent in a timely manner towards the specialist office, which will delay the care for the patient because the visit will not be scheduled in a timely basis. So with MD Health Tech, what happens, like doctors usually prefer us because they trust us. We are HIPAA certified. They like outsource their referral process to us because we give them a dedicated resource out here who obviously works on referral, whose task is to complete the referral process from PCP towards the specialist and even to check whether the referral is being authorized on the particular codes, particular diagnoses are mentioned into the referral, and sometimes it happens like doctors do come upon the portals, but their address is not correct. NPI, everything is correct, but address is not correct. So then again, the referral coordinator has to go and get the address corrected. But with MD Health Tech, since the dedicated resources there, everything is being streamlined. Every step is being monitored.
And can you tell us what hesitations do practices have about outsourcing and how do real outcomes address them?
So usually what happens, doctors or the practices, they usually think that if they are outsourcing to a company, whether they are HIPAA compliant or not. MD Health Tech, we are HIPAA compliant, and we do have HIPAA compliant medical assistants working with us. If anyone of the doctors want the HIPAA certificates, yes, we can provide them with the HIPAA certificates as well for our MAs. Second hesitation, what they have is that whether they are like their patient data is secured or not. So obviously, if we are HIPAA compliant, we are most like the you could say the first priority is to make sure that the PHI is mostly secured. It's not leaked to any
Mhm.
of the other XYZ portals. Plus, they think that if they will be outsourcing, so whether their tasks will be performed with you could say particular efficiency and accuracy as they were being performed into the clinic. Yes, they will be performed 100 times X with more efficiency and more particularity because a dedicated referral coordinator will be working on that side. If there will be any question for a patient for a referral, they can call the referral coordinator for that particular doctor's office and they can get the issue resolved at the same time. If there is an urgent referral that the patient is requesting to have an appointment with the specialist, they can call the office to that particular medical assistant and they can get the referral on track.
Awesome.
Very informative.
It's
Thank you so
very good
much
to
for your
patch,
answers, Stephen.
Anytime.
it's very good to patch up those major misconceptions. But over the last 3 months, we've mainly talked about prioritizations, referrals, about who MD Help Tech is, and we've even brought in someone we worked very closely with. Now, as we've gone over these three, we want to thank you all for going over this series with us about learning about how you can impact your your front desk and how to optimize them truly. Now, with this webinar especially, if you text the number going down below, 630-313-0856, if you text it referral and book a meeting, the first month will be completely on us.
Thank you.
Look out on the next social media pages for our next webinars. Our future webinars will be more about what MD Help Tech does and who we are as a company in total. Thank you so much all for joining us. Thank you, Karen and Stefan, for being here with us today.
Thank you.